Are you kind of feeling a little bit sick, maybe gaining weight, losing some hair, and you're just not feeling right? Odds are you have a disease that you have been incorrectly diagnosed with. So we have Dr. Stephen Wander here with us, and an alarming amount of women are being misdiagnosed with a thyroid disease. Can you kind of explain why?
Well, the research says that most women diagnosed with a low thyroid disease actually don't have a low thyroid disease. They have an autoimmune disease which attacks their thyroid. So they have the wrong diagnosis. So they suffer from symptoms, whether it be inability to lose weight despite good diet and exercise, extreme fatigue, their hair is falling out when they brush their hair, brain fog. That's why I have this Boomerang. I had one patient one time, she had so much brain fog that she had to download Boomerang software to put emails in at 9:30, 9:45, at 10, so they would come out at 3, 3:15, and 3:30, so her boss would think she was working. And so they have the wrong diagnosis, and therefore their doctors are telling them their labs are normal, but yet they still suffer from symptoms and they have no idea why.
And they're being treated, they're getting medication, and you're saying 97% of women have this misdiagnosis. What is the correct diagnosis?
Well, they must get tested. 97% of women actually have an autoimmune disease that's attacking their thyroid. And so my recommendations are, number one, you get tested. That if you've been diagnosed with low thyroid disease or you have any of those symptoms, you must get tested. And then when you get tested, you must then find out what are the specific causes, or what I call the triggers, of your specific symptoms. And that could be many different types of testing. Saliva testing, food intolerance testing, stool testing, genetic testing, it depends. And then when you can find the actual causes, then the person can get a customized treatment plan built from the ground up to then help them with their symptoms so they actually start to feel better.
Now, if we know about this autoimmune disease, we know so many women are being misdiagnosed. Why does it keep happening?
Because there's no drug for autoimmune disease. The drug that's prescribed for low thyroid disease is Synthroid or levothyroxine, which is the #1 prescribed drug in the United States at a clip of 23 million a month. And so there's no drug for it, so they need to find a doctor who knows how to treat it, because traditional doctors don't know how to treat it because in their toolbox is just Synthroid or levothyroxine.
And there's, of course, a lot to unpack with this. This is a very complex idea, and you have a book about this. Very quickly, tell us a little bit about your book.
It's called It's Not You, It's Your Thyroid, and it basically helps patients, mostly women, kind of veer through all the cobwebs and all the misinformation and wrong information that they might be reading by themselves, whether they find it on the internet, hear it from their doctor, or whatever. It kind of helps them go from point A to point B so they don't think that they're crazy.
And where can they get this book?
They can get it on Amazon. It's just coming out. Just look for it. It's Not You, It's Your Thyroid.
All right, thank you so much, Doctor, for being here, and great information.
Thank you very much.